Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all stand together to help prevent the spread of coronavirus. Dr. Schwartz, the COVID-19 vaccine has received the green light from the FDA, and the first shipments were sent out. You are spearheading our vaccination task force. Where do we stand at this point?
Well, again, an excellent question, Sandy. And you know, this task force, again, is a subcommittee of our coronavirus task force committee. And what we're really doing, it's an interdisciplinary approach. So all the affiliate leaders are part of this committee. And what we're working hard to do is to streamline the approach so that it's uniform throughout the continuum, that we have we're ready, we have a set process in place. And there's lots of parts and pieces, but it's coming together very, very well. And, we're working with CVS. There's a lot of, at least for the most part with CVS, I think Chester Village is with Walgreens. But the point being that, I think we're well positioned to kick off this vaccination process. I'm very excited about it. I think next week's going to be a great week and a big step forward for all of us. That's going to finally give us slowly but progressively more and more freedom and give us all our lives back, and particularly protect our elderly residents, which is really, a big part of what this is all about. So I think that the key of what we're focusing on is communication, and we want to be as open and clear as possible. And what we have been doing is staying abreast of CDC guidelines and looking at all data that's published to the FDA and so forth, so we can give you the latest information that we can. We're trying to, put information, out in different newsletters and so forth. And I think that's the key. It's just that, we're learning as things evolve. But the more and more that I hear of things, I think this, the Pfizer vaccine, it's a solid vaccine. It's a safe vaccine. We're taking all precautions as recommended once the vaccine is administered, and I think it's going to be a very successful process. And the only other thing that I might say, again, just trying to capture in my mind what I think the whole key of any kind of new process is trying to allay fear and trying to to communicate as much as possible. And you probably heard of Madame Curie. Madame Curie was a French-Polish physicist, and she was a chemist, and she conducted pioneering research on radioactivity. And she actually won the Nobel Prize in chemistry and physics. Imagine this, in the early 1900s. And she said this quote, which is what I want to try to focus on in my campaign for vaccination: nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. And that's really the whole key. Knowledge and understanding takes fear away. And that's what my goal is, leading our vaccination campaign.
Wonderful, and always with the perfect quote, Dr. Schwartz. And JP, what are you hearing about the rollout plan for Connecticut and Masonicare as shipments of the vaccine begin to arrive?
Sandy, that's an excellent question. And the first, before I answer that, I do want to also let you know that Dr. Schwartz and I will be one of the first to get the vaccine here at Masonicare. We are very confident in the vaccine and feel that to alleviate some fears or people that may be concerned that they may not feel it's safe or whatever, we truly, both Dr. Schwartz and I are very much in favor of this vaccination and will be one of the first to be in line to get it. So it's definitely something that as we continue to see the research, see the data, as many of my staff know, data tells the story. It alleviates and eliminates all of the rumors, worry about the data. So we are definitely an organization that feels that the vaccination will help reduce that spread, will flatten that curve. As for where we see the shipment, I'm happy to say that our partner CVS has scheduled a vaccination time with us, which will be next week. We will be doing our nursing home, our residential care home, our employees, and our assisted living here in Wallingford, all in the next week. And we're excited about that. I think it's a great day for Masonicare. It's a great day for the state, and it's a great day for the country for us to be able to get this vaccination out. Now, with regards to our independent living and our other assisted livings, we are anticipating those happening a few weeks thereafter, more in the January timeframe. With the independent living, it may be a little bit longer than that. It all is predicated on when we will see the vaccinations from CVS. But our expectations are in the next 6 months, all of our employees, all of our residents will have the opportunity to have the vaccination. And that's extremely important to us. It's extremely important to really the community that our organizations are part of. This will allow us to create some more normalcy. I also would like to talk a little bit about something else. Time Magazine came out with Person of the Year, and I have to tell you that I was very surprised that healthcare workers and essential workers were not recognized as Person of the Year. And I'd like to give a shout out to all healthcare workers, all essential workers, for what they've done this year, because they are the Person of the Year in my book. And I will tell you that they are my heroes each and every day. Everything that they have done to keep our residents, patients, and clients safe, and to keep this country moving has been truly amazing. And I'd be remiss not to recognize them as our Person of the Year.
Beautiful, JP. Absolutely. Couldn't agree with you more. We have so much to be grateful for, and it starts with all of those unsung healthcare heroes. Well, thank you both so much for sharing your time with us and all of this important information. And thank you for watching at home. We'll continue to check in with you and give you updates on a regular basis. Until then, we hope you'll stay safe and stay well.